So welcome back to Bedhead Cast. This is our fourth episode, and the title of the episode is Self-Awareness, A Sleep Doc's Journey. Today I'm going to share my experience with being diagnosed and treated for obstructive sleep apnea. And it's going to sort of go through the lack of awareness that I had with symptoms and having a bed partner who made me aware of my symptoms, going off to my doctor, getting diagnosed and not believing the diagnosis because I'm a sleep doctor. And then finally being treated and what it feels like to be treated. So we'll also discuss advocating for your own health care and mitigating the possibility of a misdiagnosis. So we've got lots to talk about. We're going to move on to the word of the day. Chris, what is it?
It is Bodhi. Bodhi.
What is Bodhi?
Bodhi is it's a Buddhist term that means enlightenment or awakening. I guess that's related to sleep.
To sleep.
And but it's essentially the essence of self-awareness.
Ah, okay, that fits with my little journey.
Exactly. And I want to hear about your journey because I think it requires some elaboration.
Yeah, it's an entertaining story.
It is entertaining.
So you know that I have been a sleep physician since 1997.
Okay.
Okay, so that's a long time.
Yes.
I've seen a lot of patients with obstructive sleep apnea. I've treated them. Some have won, some have lost. The ones who win love you. The ones who lose, we try and help in other ways. But the bottom line is I know a lot about sleep apnea, and I have to say that over my life as a married man, I was never told that I snored.
Really?
But for the past 36 years, I have had insomnia.
Really?
Yes. So I have struggled with, sleep and being able to sleep and taking sleep medication and done all kinds of stuff like that. And then I finally came to the conclusion that there was no point in struggling anymore. I was just going to accept that I wasn't the best sleeper in the world and not focus on how I felt at night, but focus on how I felt during the day, which was pretty good. Gotten a lot done in my life, as you know.
Oh, absolutely.
Yeah, so, it was okay. But lately, in the last year, my wife has started to tell me that I snore, and she knocks me around in bed to get me to stop snoring. And so eventually she said, "You have to go to the doctor." And I said, "Well, no, I don't think I have sleep apnea, But I was starting to feel quite tired when I woke up in the morning, and the fact was my insomnia was gone. I was sleeping great.
Really?
But I didn't feel rested. And I was really tired. I'd gained some weight. And I'm getting old, as you know.
Yeah, you're looking younger than.
But I'm getting old.
I found this out a number within the last year.
So I went to my family doctor, and she said, "Oh, well, let's do this little test, and then you can help me because you're the sleep doctor, learn about how to do this thing." And I said, "Sure, let's do it." It was a little ring device.
Mm-hmm.
Of course, I didn't believe that it would be, valid or anything like that. But I love my family doctor, so I did it. Well, the test came back with severe sleep apnea. So immediately I didn't believe it because I know what severe sleep apnea is. It's, it's bad. I couldn't believe that I train a lot.
Yes,
and I run a lot.
Yeah.
And I've in the last 10 years have run 2 half marathons as an old guy. And so I can't believe that I have sleep apnea because I'm doing all this training and whatnot. Anyway, so I got her to get me to do the test again. So that's number 2, exact same result. Still didn't believe it because I'm a guy and I'm a sleep doctor. So, lack of self-awareness. So I did 2 more sleep studies of my devices, which are quite valid, in the home. Exact same result.
You need some Bodhi.
Yeah.
You need Bodhi.
No Bodhi.
Okay.
0 Bodhi.
No Bodhi.
Okay, so that's 4 sleep
That's
studies.
not good.
That's 4 sleep studies.
It's not good.
So then I went to the sleep lab because I have a sleep lab. And I spent the night in the sleep lab. And when I woke up in the morning, I looked at the tech, who's my staff, and I said to her, I said, I don't have apnea, right? And she just started laughing because it was really severe. And that's in a sleep lab. Like,
Yeah.
you can't argue with that. So I had to accept that
She wasn't laughing with you.
No, she was
laughing
at me.
you. Yes, exactly.
Absolutely, yeah.
Trying to make a point.
Trying to make a point. And
There you go.
she did. And so finally I accepted this diagnosis. But the point that, of course, you're making, and I think that's important for us, because that, as physicians, it is self-awareness. We evaluate patients about their own self-awareness. But here I was the patient and had no bodhi.
Yeah, I mean, it's without self-awareness, you can't have well-being.
And I heard you say that when we decided to do this, and I thought it's a very good point, actually, because it's innate in me when I'm seeing a patient that I'm always evaluating their actual awareness
Right.
of the problem.
Right.
But it's not something I think about.
Yes. Yeah.
So
yeah.
you made it operational with the word bodhi. That was awesome. That was pretty cool. And it's like, yeah, I do this every day, all day long. And good doctors do this
Yes.
because they want to know what's the potential I can help this person. Because if they have no awareness, like me,
Yeah.
can't be helped.
Yeah. It's something I've said to patients over the years. Do as I say, not as I do.
Exactly.
So somebody who's as aware of the symptoms of sleep apnea,
Yeah.
weren't you able to
You're
recognize
baffled.
what was? Did you have
You
something
thought I
else
was
on?
smart, didn't you?
No, I assumed you had something else on your mind. Probably your patients.
Well, that's just it. What our life is like. We just plow on, right? But this had come to a point where it was sort of after the Christmas holiday season where I really started to feel not well.
Yeah.
And it was becoming quite apparent. My mood was going down for no apparent reason. There was nothing going wrong. I was very tired when I woke up persistently, no matter how much I slept.
Yeah.
And I was sleeping well, which I don't normally do.
Is that right?
So I had turned into a real apnea patient.
Wow.
As opposed to an insomniac.
Define sleeping well. Define that.
Well, for me, it would be like I went to bed and I was out.
Out. Okay.
And I'd wake up maybe once in the night and then go back to bed, and I'd just go out until
Right.
morning, which, for 30 odd years I hadn't done. I'd struggle to fall asleep, stay asleep, and always stuff on your mind, blah, blah,
Yep.
typical insomniac. Yeah. And so what's interesting, you ask about symptoms. One is Dorothy, my wife, said I snored.
Right.
Right. Not aware of stopping breathing. But this is hilarious. I have the most amazing massage therapist in the city of Calgary. I've been seeing her for 10 years. And in the last 3 years, she has said, Dr. Chuck, you stop breathing on the table. Because I always fall asleep.
Yes.
And none of her patients can fall asleep. Because
Yes.
she's like,
Yeah.
torture.
So you're feeling
It's
it. Yeah.
torture. And I just fall asleep. And anyways, she would say it, and I go, yeah, whatever.
Yeah.
No bodhi.
No bodhi, and starting to creep in. Denial is
Totally.
not just a river in Egypt.
Absolutely. It is not just a river in Egypt. It's me.
Yep.
Yeah. So I had all the symptoms. I was snoring. I was stopping breathing. Multiple reports from different people. And I was feeling...
Including your lab.
Yes.
Including
Yeah.
the lab that you have built
Yeah.
over time to
Yeah.
make sure
Other
that
people
it
are fine.
doesn't. Yeah, exactly. Yeah.
So anyways,
Oh, stop. Chris, could you ask a little bit more about the denial part? Can we maybe get into that?
Well, I could. Yeah, the denial. There's so many terms for things in psychiatry or in general, and the other term that's used is blind spots.
yeah.
And it's, I think, classical blind spot in that the way you're presenting yourself is you're okay.
Yeah.
And the other person knows that you aren't
not
okay,
okay.
right? You know, your wife is pleading with you.
she's
Your
loving this.
massage therapist, the family doctor,
The gym.
even your own lab.
At the gym, I'm the grumpy old guy.
Oh, yeah, I know. Well, you told me that you were feeling so much better recently that you said I couldn't even run.
No.
You could
Yeah.
not run.
No.
You stopped running, or you could barely run,
No.
and now you're running
Yeah.
like the deer that I know.
Absolute.
Yes, you're like a
The
deer, when you
the
run.
gazelle.
You're a deer. It's like a gazelle almost. Yes, not a cheetah, but certainly a deer or a gazelle, maybe.
No, it's true, and it's slowly happened in this sort of first half of 2023, and you know, we're busy. We're busy, and you just put things off. And my entire career, I've put off, you know, most of my health issues just because we're busy and we're working and whatnot. But when it catches up to you and starts to really affect you,
Yeah.
you start losing your blind spots.
Exactly.
And that's
yeah.
what we see with patients, you know, when they come in. I'll see a patient 10 years after, and it took them 10 years to go, yeah, you were right 10 years ago. And it happens. And so I think I'm that classic
Yeah.
person. So,
Yeah. It's bad enough if you see your massage therapist who says that you've got sleep apnea or you've got a sleep disturbance.
Yeah.
When you actually go to a sleep doctor and you leave and say, oh, no, I don't have a sleep
know.
problem. But I mean, you've mentioned before what the difference when couples come in.
Oh, yeah.
Tell
Yeah.
me a little bit about that.
Yeah, the blind spots really show up. It's really quite funny. And, you know, I've said this to you. The line that I'll use, like typically a guy coming in and with his partner, and of course the partner has a big investment in him coming to the clinic.
Oh, for
'cause
sure.
It, you know, probably took her, 2 years to get him to come. And she can see what the problem is. He's going, I'm fine. I go to work, I do this, I do that. But, the fact is, when they're desperate, when the patient is like, I am desperate, and you're trying to get them to understand that there's a problem here, I'll often confront the individual and go, okay, who knows you best? In order to get them to the point of understanding that there's someone in their life who has been telling them this for a while, because I know that that's the case. And you should start listening to them. Because,
Yes.
of course, we don't listen to our partner.
Yeah.
We never do.
Well, yeah.
Yeah. We're bad.
We try.
We try.
We're a work in progress.
Very much so.
That's all we are.
Until we're in the ground.
Until we're
Then the work is over.
And then the work is over.
So, no, I'll often confront the individual and go, who's the most person who knows you the best? And, of course, it's your partner, right? Your partner is the one who knows you the best. And if they're, you feel like they're badgering you, the fact is it's not badgering. It's they care and they're recognizing something you're not aware of. Keep in mind with sleep apnea, the patient really doesn't know they have anything wrong with them because they're sleeping.
Exactly.
And I had
yes.
transitioned from a non-sleeper to
Yeah,
I
no,
was sleeping.
exactly. You
I was
thought
quite
it had
happy I was
improved.
sleeping. Yeah.
But I mean, the thing that you've also, I think, made very clear is that if you want to know whether somebody is sleeping okay, it's when you wake up.
Yep.
And if you're exhausted, there's got to be something wrong with your sleep.
Exactly.
Yeah.
Yeah, and always ask the partner.
Yeah.
'Cause we always get the partner's opinion. Yeah.
Yeah, absolutely.
Yeah.
I mean, there's also there's a cultural side to this, which we've talked about before, where the new culture is we're supposed to be the best that we can be. We're the greatest person that we can be,
Yeah.
right? Instead of we're all flawed.
Yeah.
We all got our problems, and we gotta be candid about that, which then allows us to become aware through the people that know us.
Yeah. Yeah. No, that's the deniability. And
Yes, exactly.
I'm fully like, that was me for sure.
Yeah.
This has been quite a lesson because the fact is, with treatment, it was a real struggle for 3 months to, use the treatment, the CPAP machine at night. But I couldn't believe the difference in the gym. That was the biggest thing for me, is my entire body changed dramatically. And I was very hypoxic. My oxygen was very, very low. So in spite of all the training that I did, I wasn't recovering. And this last year was where I would start running and then have to stop after 15 minutes.
Yeah.
Like I couldn't run any further. I'd have to walk, and I never did that before.
And it's such a healthy, everybody argues about you should exercise as a coping mechanism.
Yeah.
It's absolutely true, but it's when perhaps the insight of you being able to say, I need to exercise, and it's becoming, I can't exercise, which would be a real problem.
It was struggle. And it was hard because exercise for me is like, it's therapy. And we know this now. We know that exercise is critical for mental health and whatnot. But you have to exercise on a rested body. The idea that some are promoting where you just exercise whether you're rested or not, I do not agree with. You need to be rested to gain the benefit from physical activity that's critical.
Yeah, and less so now.
Yeah, absolutely. Yeah.
With this enhanced performance, where you're getting back to the reverse aging thing that I've been telling you about.
Yeah, absolutely. But I want to talk about this one. So there's the other side of the coin here, is the patients that we see that are misdiagnosed with sleep apnea. And that's very unfortunate. And it depends on where you are in North America and the medical system's approach to sleep apnea. But we'll see patients, and I actually saw one today, a woman in her mid-60s who 2 years ago went specifically to her doctor with insomnia, was sent to a community-based CPAP type company, given a sleep study, but shouldn't have been. It triggered a diagnosis of mild sleep apnea, and she was given a CPAP machine. And of course, it made her insomnia worse. And she struggled for 2 years before she just took action in her own hands, found the website, came and saw a sleep doctor who said, no, you need to have your insomnia treated, and maybe you have sleep apnea, but we have to figure that out first. So these people will go for years with inaccurate treatment, poor diagnoses, and there's a lack of knowledge around this area. So I think it's really important in this session to sort of talk to people about, if you're struggling with sleep, you get help, and 2, if you got help and it's not working, keep looking.
Yeah. Well, it sounds a little bit like, if you sell CPAP machines, it's a little bit like, you have the hammer and all it can see is nails.
Exactly.
The versus sleep clinics are designed to make diagnoses and recommend what is the best treatment. Versus, we're here to sell sleep. I have a story about chimpanzees, and it's about self-awareness and how the chimpanzee has Bodhi.
Oh,
the chimpanzee has Bodhi.
So it's better than me.
It's slightly better, but now, you're growing all the time. Things are getting better.
Okay. Thanks.
How did they figure out that chimpanzees have self-awareness, that they know themselves?
Okay.
And this is how they figured it out. They took a chimpanzee and they were in a room, and the chimpanzee was comfortable in the room, and there was a big mirror in the room.
Okay.
And so the person running the experiment went in and gave a short, sort of minor anesthetic to the chimp. So the chimp goes to sleep, and they take a marker and they put a mark on the chimp's forehead. Okay? And they leave. So the chimp wakes up and looks in the mirror, and instead of thinking there's another chimp there, they reach up and scratch their forehead. And this was a very interesting, and elephants do it too. Now, I'm not sure how you reach an elephant's forehead without a ladder.
Right.
But they did the experiment, and yet there are monkeys that don't. It looked like they didn't have self-awareness because they did the experiment, and same thing. Put the monkey to sleep. Go in. Put the mark on the forehead.
Yeah.
And this one group of monkeys didn't see it. And then they realized that the monkey never looked, this type of monkey never looked at the forehead. So they took the mark and put it on their neck, and they immediately scratched it. You know, it's just, and it's working with, you want to work with, if you're going to do research on other animals, you've got to use the animal's language, where they're able to express to you what's going on. Enough about monkeys.
Enough
about the monkeys
and self-awareness.
Let's talk a little bit about what I learned, over the years, or maybe the average person thinking. A person can't have sleep apnea if they're not overweight, or they're not older.
So that's not true.
That is not true.
No.
Tell me about this.
Yeah. So originally it was believed that the condition obstructive sleep apnea only occurred in obese people, which is very much not true. If you are obese, you are at higher risk for having sleep apnea. But sleep apnea occurs as a result of anatomic issues independent of obesity.
Okay.
And that has to do with the shape of the jaw.
I see.
Okay, so there's that anatomic issue. There are cultures that have way higher prevalence of sleep apnea than other cultures in thin people.
Okay.
So that's another.
Yeah.
And then there are other factors that cause sleep apnea. So, for instance, the integrity of the upper airway, which is affected by alcohol, smoke for smokers.
Okay.
And then dental issues as well.
Right.
So there's many factors that play into whether someone would be at risk for having sleep apnea. And definitely age does not mean you won't have it.
Is that right?
Absolutely not. No.
Okay.
No.
Who's the youngest person that you've treated for sleep apnea?
Well, not me, but I mean, infants have sleep apnea.
Really?
Yeah. And so, this is right in the beginning of life all the way up to the end of life. People can have sleep apnea.
Wow.
Yeah. And children have it.
Wow. And like that, they used to have that syndrome called sudden infant death syndrome. It used to be
separate issue.
That is a completely
separate.
I'm glad.
Yeah.
Yeah.
Another condition of apnea.
Yeah. But again, an airway issue, or perhaps
there's other factors.
Yeah,
there are other
exactly.
factors in control of breathing.
Yeah.
That play in with SIDS. Yeah.
Right.
Or sudden infant death syndrome. Yeah.
Right.
Yeah.
Okay. Yeah. My homework today is a quote. It's about self-awareness, and it's mirror, mirror on the wall. I'm like my mother after all.
That's a good one.
Chuck, take it away.
Yeah, so my homework is that, if you are thinking that you might have a sleep problem, which could be that you struggle to sleep, so it's obvious, or that you sleep but you wake up tired, and that's consistent. The way to start your journey in getting or solving a problem is to look to your bed partner. And if you don't have a bed partner, ask someone to just observe you sleep for an hour one night and see if they see anything abnormal. Because keep in mind, sleep disorders are mysterious, and often individuals aren't aware that there's something going on in their sleep. They just know that they're unrested when they wake up, or they really struggle to fall or stay asleep. So ask someone, and then begin your journey by seeing a healthcare provider.
So for our next episode, it's going to be the Blue Light Special, Sleep, Sanity, and Screens.
Sounds good.
So
See you next time.
See you next time, and let's make sure you put your head to bed.
bed.